Hi, it's Kathy Press again, and I am doing my YouTube channel on geriatric care management, and right now I am covering nonprofit. Should you, as a nonprofit, add geriatric care management as an income stream? And as I mentioned in the first segment, a lot of nonprofits have done this. Jewish Family Services has done it for a long time, Catholic Charities. You can look at it as Robin Hood. But it's also, survival, in that government grants are drying up for nonprofits, and donors are not donating as much as they used to, and so it's an additional stream for that. So we were talking about a feasibility study, and the next part is a competition survey. We just looked at your ideal client and how you measure that through the census, and now we're going to do a competition survey with who's your competitor. And nonprofits don't often think that way. So we've covered what are the most profitable markets, the demographics, and the demand, level of age and disability. So now we're going to look at competition. And you need to figure out what competition exists in the market. You've already done your geographical footprint. You've figured out what county or borough or state, usually it's the first, has the highest concentration of people who can afford it, that are older, etc., etc. Look at the other ones for that. And now you're going to figure out who is your competition. And your competition are other geriatric care managers or people that pretend to be private geriatric care managers. And geriatric care managers, you have to look at how many geriatric care managers already exist in that county or that borough that you've decided to focus on, because it has all the right demographics. What you want to do is create basically a survey of this. So you're going to figure out how many geriatric care managers are in the little county or the big county or wherever you're going to look. And then you're going to figure out there are many, many home health agencies that now advertise geriatric care management when they don't have a geriatric care manager. And a geriatric care manager is a very specialized human being who's well trained in geriatric care management, has a lot of problem-solving skills. But marketing is marketing. So they have to be looked at as your competition as well. And what you're doing is you're finding market share. So when you do this feasibility study, you're going to design a survey. And you're going to survey the other geriatric care managers in the county and the home health agencies. And you're going to find out, first of all, what do they charge per hour? Because a lot of setting fees is what the market would bear. You want to, you can charge up to $200 an hour as a geriatric care manager in New York City, where it might be $50 in the Midwest. So you can't charge $200 in the Midwest if you want to, you wouldn't be able to compete. You want to figure out do they offer home care? Does the geriatric care manager offer home care? Often nonprofits have a whole system of they have assisted living many times, they have a hospice, they have home care. A geriatric care manager might not have that. That gives you an edge to your competition. Do they charge for travel time? You have to invent a whole bunch of questions to figure out, what is your competition and how can you get market share by people choosing you because you have a better service. And so then you want to know the credentials of the geriatric care manager. Like I said, in a home health agency, you might have somebody who's just a social worker and says they're a care manager. A care manager needs to know how to solve really, really difficult cases. And you need somebody who's really been trained in that, has experience. It's hard to find that person. So that's the next part of a feasibility study, and we will go on to the next chapter, and that will be I think number 5, and go to my website, kathypress.com, and we will see you next time.